Committee will come to order. The Affordable Care Act has changed how Americans receive their health care. There's been ample debate over the last 4 years about the ACA and what impact it will have. Today we have the chance to look in the rearview mirror and judge results rather than the rhetoric and promises. And we have the opportunity to look forward to next year to see what other changes and surprises may lay ahead for the American people. It's no surprise that I and many of my colleagues on this side of the aisle were very concerned about what would happen with the rollout of the ACA and the healthcare.gov. Unfortunately for the American people, many of those concerns came true. The ACA has helped some Americans, no doubt, but has hurt many more. Millions of families lost their doctor and their health care plan. Millions more saw their premiums spike because of new taxes and regulations that provided them with no additional coverage, just more costs. And many more workers saw their hours cut as businesses prepare for further mandates. But worst of all, many Americans have lost trust in our government when it comes to being honest about its health care promises. Many patients fear what may be in store for them next. They've lost their health care they have and like, lost their doctors, and are seeing their premiums soar. And for those that ended up in the government exchanges, the ones that the law was supposed to help, they were subjected to a disastrous rollout of healthcare.gov, delays as paperwork went missing, and the ongoing reality that they may owe thousands of dollars back to the IRS for subsidies they're not eligible for, not because they did anything wrong, but because the ACA income verification system was not and still is not working. But the administration assures us next year is smooth sailing. Unfortunately, the answer to that is no. Open enrollment has been delayed until November 15th. Worried that individuals won't enroll, the Centers for Medicare and Medicaid Services recently announced that if individuals don't select a new plan by December 15th, they'll be auto-enrolled in their old plan. The problem with that, however, is that their premium tax credit, if they get one, will be based on the one they're receiving today, whether accurate or not. If a person wants to accurately know how much of a subsidy they'll receive for 2015, they need to go through healthcare.gov again. Yes, the healthcare.gov that was just hacked carries the risk of putting Americans' sensitive personal information at risk. In plain English, that means that working families will have to wait that much longer or work that much harder to find out how much their health care will cost next year. It's not right for those trying to put together their family budgets right now. What is also not right is the fact that the ACA's income verification is still not working. Despite Secretary Sebelius' certifying to Congress on January 1st of this year that a working verification system was in place, the HHS Inspector General found that there were nearly 1 million income inconsistencies on exchange applications. Because individuals were able to self-attest to their income levels, there was little data before taxpayer subsidies were sent out the door. And if the data is wrong, thanks to the horribly poor implementation of the bill, hundreds of thousands of Americans could be hit with the nasty surprise when they do their taxes next year. Could be forced to pay back hundreds or even thousands of dollars. Recently, a Treasury Department spokesperson suggests that the ineligible subsidy that someone owes back to taxpayers could be capped. That's not how the law is written. Individuals who are not eligible, either because of improper income data or coverage from another source, must repay the entire amount. The ACA tried to invent a system that would collect that information to prevent things like this from happening and improper subsidies. But guess what? It's proven so far to be too complicated and too burdensome. The administration has admitted time and time again that the law doesn't work, delaying one provision after another or exempting special interests or politically favored friends from the most onerous parts of the law. And while the mandate on local businesses is not being enforced, for 2014 the mandate on individuals to buy government-approved health care or pay a tax is. That certainly doesn't sound fair to me. And that's why this White House has lost, in my view, the trust of the American people. Today's hearing is an opportunity for CMS and IRS to begin an open and honest conversation with the citizens of the great country about their health care. And before I recognize Ranking Member Dr. McDermott for the purposes of an opening statement, I ask unanimous consent that all members' written statement be included in the record. Without objection, so ordered. I now recognize Ranking Member Dr. McDermott for 5 minutes for the purpose of his opening.